My name is Lori, and I am from the United States, a state called Maine, and I am a family nurse practitioner. This is my first time in Nigeria. Hot, very hot, but I love it. I love the countryside. I love the people. It's been a very good experience. I'm learning a lot, but yes, overall I like it. I was compelled to come here. The Lord spoke to me when this mission trip through my church became available, and they were asking for applicants, and the Lord said, apply. So I hesitated, and he said, apply. So I did what he told me to do, and here I am. Yeah, I haven't been in on too many of the surgeries because I've actually been seeing patients like I do in my home, but the surgeries I have been in on are substantial. It's not like any type of surgeries that I've seen in the United States as far as the conditions that they're being operated on are worse, much worse than typically what we would see in the States. I love the orphanage. I love the kids. They already taught me how to do some games with my hands that I didn't know before and sing songs, so that's been really good. They look like they're very happy. That was the main thing that I noticed, is these children, despite their circumstances, feel loved and secure here, and that meant a lot to me. The hospital is great. It's basically the same type of services that we get at home. You guys are open 24 hours a day, so I'd say it's comparable to what we see back home. Come here. Come here. Come here and meet these people. Come to this environment. Be part of this culture as soon as possible. As absolutely soon as the Lord compels me to come back, I will be coming back, yes.
My name is Jamie Went. I'm from Kennebunk, Maine, and in the real world, I am a labor and delivery nurse. It is my first time to Nigeria, yes. This has been a great experience. I'm just so blessed to be here with the team and with these people. It's been life-changing. It's been wonderful. I came here because honestly my dad had been here a few times, and he just thought it was great, and I was very excited to hear about the medical interventions that you do here, and I just really wanted to be a part of that. So the operations have been great. It's been a learning experience for all of us because we come from different parts of the world, the country, and we use different equipment and we call things different names, but it's a great opportunity for the Lord to work and to learn to work as a team, so it's been wonderful. The kids are great. They're happy for us to be here. I wish I could be in two places at once because, of course, the kids from the orphanage want to play and have fun, and we have surgeries to do too. But it's just a blessing to see the work that you do here. It's wonderful.
My name is Dr. Kurt Davis. I come from Kansas in the United States, and I come over here to Mercy Angels Hospital to do surgery. No, this is my fourth time in Nigeria. Yes, the whole church compound has been very open and inviting to us, and I know that a lot of people have been blessed by not just the medical care here, but the spiritual care that the church has been able to provide. And I'm going to keep coming back because of all that God is doing here at this place. It had been too long is the reason. It had been a year since I've been here, and I'd been missing Nigeria, so I'm glad I came back. I just know whenever I'm here, even though the work is hard, I feel refreshed and energized from God's power. The operation's been going well. They've been going very, very well. Many people have been helped and healed from their infirmities from the time that we've been here. So I think that don't be fearful of coming here, because God will give you travel mercies to come here because you're doing His good work, but also feel His blessings from your faith to come far away from home, possibly to help others that are in need.
My name is Esther. I am from Maine in the U.S. I am the nation's outreach coordinator at my church. It is my first time in Nigeria. Our pastor had come here on a trip. He met Pastor Tunde and the ministry that is being done here, and he decided that this was a ministry that he wanted to partner with, and so we began to bring teams here, specifically medical teams during the medical intervention. I have found Nigeria to be a very warm and welcoming place. I find the people to be very open and loving. I enjoy the food. I enjoy the weather. And I really enjoy all the lizards that I've been seeing around the place. It's my favorite. We found out about the Restoration Ministries through another pastor friend, Pastor Femi in Wales. And he kept asking our pastor to come, and for a few years our pastor just wasn't able to, and a few years ago our pastor felt the call of the Lord to tell him, this time you need to say yes, and so he made the trek down here, and his heart just connected with Pastor Tunde and the ministry here. I am not a nurse. I simply bring teams places, but I was able to sit in on the, are you talking about like the actual operations or just like in general? Like, I've been able to sit in on the surgeries being done that the doctors have been doing, and just seeing the level of care and professionalism that is provided to the people has been very eye-opening, seeing that they don't have much to work with, but what they work with, they are able to provide good health care to the people here. The other parts of the ministry, such as the orphanage and the church, and the schools that they have, everything has just been very impressive, just seeing the way that the students are very respectful, seeing the smiles on the kids who are living within the orphanage. They're happy, and being able to worship with Restoration Ministries on their Sunday morning service was a complete blessing. Yes, if the Lord allows me to come back, I would definitely come back to Nigeria and to Restoration Ministries. I will be very sad if the Lord says that this will be my one and only trip.
Thank you. My name is Dapo Mabadija. I'm from Ogun State in Nigeria. Well, I presently reside in Prince Albert, Saskatchewan in Canada. I'm a general surgeon. I do a bit of general laparoscopic surgery. And where do I reside? I reside in Prince Albert in Saskatchewan, Canada. It's been exciting, and it's always good to come back home. Like they say, home is the best. So it's been nice coming back to Kaduna. I was in Lagos last week, and just noticing the difference between the weather and the people. It's just been nice seeing people joyful and happy as always, even with the little they have. Just been happy with what God has given them. Well, I spoke to Reverend Bolanta a while ago. We were together in Canada when he came visiting and doing some missionary work. And he told me about it, and we decided that it would be a good thing to come and just give back to the community. I spoke on the phone with Dr. Stewart. He was in Dallas then, and we had a chat. So I had a vague idea about what the equipments are and what the needs were, but the general perception was trying to help the underprivileged, and that was a draw for me. And I decided, well, sure, if Americans can come here, why not go and give back to Nigeria? They've all gone very well, and we praise God, and God is on its own. The patients are all doing very well. How have they been? They've been a little bit challenging because I've been away from Nigeria for a while. I'm not used to using limited resources, but I have to commend the facility that's available and what is around. We've been able to use what we have to achieve as much as possible for the patients. So things have gone quite well. I'm quite happy with what we have right now and what we're doing. Yes, I went through, took a visit to the orphanage yesterday, and spoke to some of the kids, and they all seem quite happy and contented. And Bible says when you are contented, that's great. So invaluable resources to have orphanage, especially in a town like this. And I think the ministry has done quite well, and I pray that God will continue to increase, God will continue to bless and provide for them to continue to do the good work. I mean, not many places in the country will have resources geared towards the underprivileged, and this is peculiar and unique on its own. I say, well, come in and see. You don't know what you have until you take a step, and God expects us to live by faith. You must take a step of faith in all you do, and I've been in Kaduna for about less than a week, and things are going quite well. I mean, people are friendly. There's no riot. Everything is safe. We are mixing with the people. The community is quite welcoming. I don't think there's anything to fear apart from fear itself. For sure, I'll be back. If you will have me back, I'll definitely be back for sure. And I hope when I come back next time, I'll bring some other people with me.
This is my first time in Africa, first time in Nigeria, yes. Well, I believe that the Lord called me to do this mission at this time and this season. In my life, I've always wanted to do a mission trip in Nigeria, and it so happened that an opportunity came up, so I had to take it. I love Nigeria. It actually reminds me of my home country, and there's tons of similarities as well as differences. But the people, the culture, I absolutely love it. I love the food. I love the rice, chicken, whatever. Everything. The sunshine, it's awesome. Well, Pastor Tunde has been to our church twice, and that's just how we've learned about what you guys do here. And a medical mission came up, so I wanted to be a part of that team. All our surgeries have been successful. There was people that came in with pain, and I believe that they were healed based on what we were able to do and what the Lord was able to do as well. Orphanage is great. The kids are amazing. They're just so generous and so loving and caring. It's amazing. They love us. It's really good. The people here are really nice and really friendly as well. Yes. I would love to come back in a heartbeat. I would definitely love to come back.
Yeah, I'm Dr. Stuart Quartermont, and I'm from Texas, College Station, Texas. And I've been coming to Nigeria from 1988. And then we came to Kaduna and started working with Pastor Tina and Tunde Balanta and Restoration Bible Church. And we started this hospital, Mercy Angels Hospital, a few years ago. And we've been coming about every 4 to 6 months. And we've been here for just about a week, and we've done about 30 surgeries. And we've just been able to really address the needs of a lot of people that have been here. Hernia surgeries, myomectomies, hysterectomies, burns. We had some contractures of a hand that we released on a baby that got burned. And so a lot of different things that we've been addressing and praying for the patients especially, and getting to know them, and just seeing what God is doing in this place and in this mission compound where God has really been blessing. And so we're really happy to be a part of this, and we had a team from Maine with us, and we're just really happy to continue to do the work here on this mission compound.